Hi, my name is Naomi Campuzano. I will talk about adjuvant Sunitinib in high-risk renal with carcinoma after nephrectomy. Definition. Renal cell carcinoma is the most common kind of kidney cancer found in adults. RCC occurs when cancer cells start growing uncontrollably in the lining of the tubule of the kidney. RCC is a fast-growing cancer and often spread to the lungs and surrounding organs. Adjuvant Sunitinib. Sunitinib, a vascular endothelial growth factor pathway inhibitor, is an effective treatment for metastatic renal cell carcinoma. We sought to determine the efficacy and safety of sunitinib in patients with locoregional renal cell carcinoma at high risk for tumor recurrence after nephrectomy.
Renal cell carcinoma today is a field that's dramatically changing. We're making progress in advanced metastatic disease, but for patients with stage 3 disease, high risk for disease recurrence after surgery, there really hasn't been any breakthroughs until recently. For the most part, that's been an unmet need for patients, and we've done some clinical trials looking at tyrosine kinase inhibitors in that setting. One study was positive. That was the STRAC study, which looked at the use of Sutent 50 milligrams, 4 weeks on, 2 weeks off for 1 year versus placebo in patients with high-risk disease, either T3 lesions or node-positive disease. And in that patient population, we demonstrated a 24% reduction in the risk of disease recurrence for the entire population. And at 5 years, there was an absolute improvement in recurrence-free survival of 8%. So roughly 1 out of 12 in order to prevent recurrence. Overall, for that population, it was about a 50% disease recurrence at 5 years. So this was indeed a high-risk patient population. And this was a positive study, and it led to the FDA approval. But it's interesting to us that in this context, there hasn't been a lot of use of sunitinib in this setting, and there's been some pushback regarding the results because of some other studies that were contemporary studies that didn't meet their primary endpoints.
Okay, this now talking about application in medicine. In this randomized double-blind phase 3 trial, we assigned a patient with locoregional high-risk clear cell renal cell carcinoma to receive either sunitinib, 15 mg per day, or placebo on a 4 weeks on 2 weeks of stool for 1 year on or until disease recurs unacceptable toxicity or consent withdrawal, the primary end points and disease-free survival. According to Bladen, independent central review, secondary endpoints include in disease-free survival and safety.
Clinically, when we're thinking about who to treat with sunitinib, we want to pick the patients we think are most likely to benefit. By enriching for these highest risk patients, we can really focus even further on the patients most likely to benefit. So when I see a patient in my clinic who has node positive disease, or a patient that has T4 disease, or really high grade poor performance status disease, that's a patient I'm going to be more inclined to offer sunitinib to, even if I think maybe medically they might be a little bit on the fence. They might be a little bit older, or they might have other issues. Can they really tolerate sunitinib for a year? I don't know. That's a patient I still want to have the conversation with, because there's even a greater risk of them recurring, and there's even a greater benefit associated with that adjuvant therapy.
Okay, this now pros and cons. Patients with locoregional renal cell carcinoma at high risk for tumor recurrence after nephrectomy who were receiving adjuvant treatment with sunitinib had a longer duration of disease-free survival that it does resemble placebo. The safety profile in patients treated with adjuvant sunitinib revealed moderate declines in quality of life while receiving active treatment. Okay, issues applicates in Ecuador. This project is not available in the country at the moment. Its development could improve the prognosis of patients with high-risk renal cell carcinoma after nephropathy.
Patients with T3 or node positive disease after nephrectomy have roughly a 50-60% chance of disease recurrence within 5 years. This is an unmet need we've known for a long time. The STRAC trial investigated the use of sunitinib, 50 milligrams, 4 weeks on, 2 weeks off versus placebo for up to 1 year of treatment in this setting and demonstrated a 24% reduction in the risk of recurrence with an absolute benefit of disease-free survival of 8% at 5 years. That's 1 in 12 that are not recurring that would have recurred otherwise. To me, that's a clinical benefit.
Okay, this now conclusion. Among patients with leukoregional clear cell renal cell carcinoma, a high risk for tumor recurrence after nephropathy, the median duration of disease-free survival was significantly longer in the sunitinib group than in the placebo group at the cause of a higher rate of toxic events. Okay, thank you.